Today I'm going to talk to you about the difference between cannulas and needles, and I'm going to actually show you how the two are used when we are doing injections for fillers. As you can see, this is the needle. It's got a very sharp edge to it. It's tiny, and we do use the needle quite a bit to inject fillers, and it works very well. In certain areas of the face, this is quite appropriate. For example, in the cheeks, here, in the temporal areas, around the jawline, sometimes in the lips as well. But depending on the person and depending on the kind of result we're trying to achieve, sometimes you end up having to use a cannula. A cannula is basically a long needle, but it's not a needle. It's actually blunt. See, there's no ouch. It's totally blunt. So what you do is you poke the skin with a needle, and then this cannula threads itself in. And what it does, the cannula can actually push vessels out of the way. Therefore, there is less bruising. And so people prefer that. It really depends on the kind of result you want to achieve. If somebody's got a very vascular face, the risk of bruising is very high. And so therefore, you want to use a cannula. You really have to tailor treatment for each individual person. In some patients, I will do injections using a needle in the lips, and in another patient, I might use a cannula. And in the same patient where I use the cannula, I might use a needle for certain aspects of the same treatment. So this is something you have to design to deliver the right results.